Hello, good evening, everyone. I am Dr. Avinash from Dental Planet, and today we are going live on the topic of gum health. Okay, so it will be a question and answer session. There have been a lot of people asking a lot of questions about the gum health. There are a lot of doubts regarding the gum health. So I thought let me do a live question and answer session, so that I'll be able to answer all the queries. So this session will be both in Kannada as well as in English. So if you have any questions, you can type in the comment section so that I can answer those questions and clarify all your doubts. Okay, so before anyone asks any questions about the gum health, there are few questions which have already been asked by some of my patients. So let me answer that first, and as and when we get the questions, I would be taking that. Well, one of the question asked is, Doctor, my gums bleed. Is it healthy? Is it healthy or is it normal to bleed when I brush hard, or is it the sign of gum problem? See, the first sign of the gum disease, which we otherwise call as gingivitis, is gum bleeding. So there are other signs which the dentist can notice even when it doesn't bleed. But otherwise, the first sign what a patient or an individual themselves notice about their gum health or gum disease is bleeding. So whenever gums bleed, it means that there is some gum issues, gum problem is there. Okay. So what causes this gum problem or what causes gum bleeding? Basically, in our mouth, there are a lot of microorganisms. So there are countless, there are crores together, crores or millions of microorganisms are there in our mouth. Of these, not all are pathogenic. That means not all would cause disease. There are some microorganisms which cause disease and some doesn't. When we don't brush our teeth for a while, maybe for a day or so, you'll see a layer, soft deposit which is forming on the tooth. This is called as dental plaque, and this will have numerous microorganisms. And these microorganisms enter into the gums, and in response to that, our body would yeah, produce some inflammatory mediators. Our defense cells will enter into those areas, and in response to these microorganisms, the gums get swollen. Though you may not notice any swelling, it will be to a very small extent. There will be some swelling, and also this in turn, when this is not treated for long, or if the brushing is not done correctly for longer periods of time, that is when the gum disease start. Initially it will bleed, and then there might be something called as pocket which is formed when it involves the deeper structures. So whenever you notice any sort of bleeding, whether while brushing or while having food, you immediately meet a dentist, get yourself examined, and the correct treatment would be suggested. So, what do we do for this? In case if there is gum bleeding, most likely there will be deposits on the teeth, and we would be just doing a simple cleaning, examining whether the disease has progressed deeper, and then suggesting appropriate treatment. Just a routine cleaning will help a lot in reducing most of the gum diseases. Okay, and there is one more question regarding bad breath. Can gum diseases or can gum problem cause bad breath? The technical term what we use is halitosis or oral malodor. Even if I brush twice daily, or some of them even do brush thrice daily, despite that, I do get bad breath. Is gum disease causing that one? Yes, certainly. Whenever there is any gum disease, It may be gingivitis, that means initial stages of gum disease, or periodontitis. You are very likely to have bad breath. So what happens here is, because of the bacteria which is hidden near your gum line, it is causing disease. And these bacteria generally tend to kill the host cells, the healthy cells, healthy gums which are attached onto the tooth. It will start damaging that, and that will produce lot of waste materials which gets collected in the near the gum line, and then it will come into the oral cavity, that is inside the mouth, and that is when you will have uh, bad breath. So there are certain chemicals which are produced when this get prepared. It is just like decay. When something gets decayed, you have bad smell. So here the dead and necrotic cells which are killed by bacteria, and also even your cells, even your body would start killing the microorganisms which are present. And when that stays in the mouth for a while, even for some time, it will cause bad breath. What is the treatment for this bad breath? First, as any gum disease, first visit your dentist, get a thorough cleaning done, and then you should be able to control the bad breath by brushing correctly and using correct brushes, and also making sure that you clean in between your teeth. So here again, most of them would be brushing twice or sometimes even thrice daily, but they ignore cleaning the interdental areas. Interdental areas means the spaces between two teeth. All our teeth are individual units. It is not joint, though it is very placed very close to each other, as we see in this model. So it is placed very close to each other. But there will be gap between the teeth. Each tooth is an individual unit. So this is one tooth, this is one tooth, this is one tooth, and this is one tooth, and there will be some gap between each of our teeth, and that is the area where most of them ignore their cleaning. So how to clean this? It's not possible by with your regular brush. By your regular brush, it's definitely not possible. You should be using specialized brushes, or at least a floss. Floss is a simple, a thread which is available, dental floss. It is specifically designed to clean in between the teeth. You pass on that floss in between two teeth and clean. Otherwise, the more effective one is to use interdental brush. How does the interdental brush look like, and how do we use it to clean? So interdental brushes are like this. It looks like this, if you can see. Yeah. Okay, so this we will be using to clean in between the teeth. So just insert in this area once and take it out. Just once in between one gap and take it out. Likewise, in between all the teeth, you can insert and take it out, insert and take it out. By doing this, we'll make sure that all the deposits in between the teeth, which are accumulated plaque bacteria, is removed. By doing this, you can prevent one gum disease, and also you can prevent decay which can happen between two teeth. Okay. So we have other videos which we have posted in the channel regarding what is the correct brushing technique, and how to use interdental brush correctly. Please go through that. If you have any doubts, please do post in the comment section. We'll be happy to answer that. Okay, there's one more question. If my gums are receding and my teeth feel slightly loose, is it too late to save them? So when the gums become loose, and or the gums are receding and the teeth have become loose, that means teeth are mobile. That means the disease has progressed to next stage. That is, from gingivitis, it has progressed to periodontitis. Periodontitis means there is bone loss and the gums have gone down. Again, as we see in this picture, This is an healthy tooth where the gums are at normal level. And in gingivitis, there will be only the color change would be there, as we see here. But in periodontitis, the next stage of gum disease, the gums would have receded, it would have gone down, and the bone support around the tooth is compromised. If you see from inside, so you see the bone level has gone down and the tooth has become mobile. Now, is it too late to save them? It depends on the kind of bone loss and how much of bone loss has happened. So, when you go to a dentist or a periodontist, they usually take an x ray wherein we will be able to see how much of bone support is still remaining. Based on that one, we'll be able to tell whether we'll be able to save the tooth or it is too late. There are plenty of procedures wherein we can save the teeth if it is in initial stages of periodontitis. That means once it has crossed gingivitis, from initial stage it has progressed to next stage, we'll still be able to treat that one by various techniques like we may use lasers or deep cleaning, which we otherwise call as root planing, or we may even in deeper cases like in much more complex cases we may have to do gum surgery, which is otherwise called as periodontal flap surgery, and also we'll be using at times bone grafts or other regenerative materials which will help us to grow the bone as well as gums so that the teeth become stronger. So these are the few procedures which can be done at later stage. But yes, if the bone loss is too very severe, then unfortunately we may not be able to save the tooth if it is too late. So my recommendation is before the problem becomes too severe, please visit your dentist. We'll be able to take one simple X-ray and tell you how much of bone loss has happened. Okay. Once in 6 months, it is mandated to visit dentist so that the problem can be stifled when it is small. Okay, there's one more question. Again, this is regarding cleaning. So if I get my teeth cleaned, whether it will create gaps and whether it will make the teeth loose, or whether we will be losing any of the tooth structure when we do the cleaning. Frequent cleaning, if you do, whether it will cause any problem. Okay. So this question is I've already answered this one in one of the video, but anyways, let me answer it once again. Deep cleaning or just cleaning ideally will not create any gaps. In first place, why do we have gaps? So generally there are the teeth, as mentioned earlier, the teeth are individual units separately. There are some small gaps between the teeth, but it is well covered by the gums. So we don't get to see the gaps. When there is gum disease, periodontal disease, gum, which we call the gum disease, we can generally call it as in layman's term, there is bone loss. There is bone loss and the gums recede. Now, what happens in this area? This area, it gets filled with deposits, new deposits, which we otherwise call it as tartar. Uh, in ಕನ್ನಡದಲ್ಲಿ ಪಾಚಿ ಅಂತಲೂ ಕರಿತೀವಿ ಅದಕ್ಕೆ. ಅದನ್ನ ಅದೆಲ್ಲ ಇಲ್ಲಿ ಕಟ್ಕೊಂಡಿದ್ದಾಗ what it does is it will give us a false sensation that there is no gap between the teeth. So now there are deposits on this area and we clean this area. When we do cleaning, we have to remove those deposits because that deposit is further pushing the gums down. So if you don't remove that one, it would further, the bone loss will further continue and it will result in complete bone loss and the tooth may fall on its own. So first when you come, we remove all those deposits which are there on the tooth. Now what happens when I remove the deposit from this area? Suddenly the gaps which were covered by the deposits, that is gone. Now those gaps starts appearing. Does it mean teeth cleaning caused gaps? No, it doesn't mean that. The gaps were created by the disease, and the deposits had pushed the gums down and it had caused bone loss. Gaps were already there, but it was covered by the deposits. Now, dentist is just removing those deposits. Now, suddenly the gaps which were already there, it is start seeing, which were not seen earlier. Now it is seen. Okay. So it is a myth that cleaning or scaling causes gaps between the teeth, or it will weaken the teeth. And also it will not damage any tooth structure, because we'll be using an ultrasonic instrument which will just vibrate and remove the deposits. It will just vibrate and dislodge the deposits which are present on the tooth surface. So it will not cause any damage to the teeth. So how often should you get your teeth cleaned? So if you're maintaining very well, obviously there are no deposits on your teeth. So there's no way that we dentists will be able to clean anything. If the tooth is already clean, we don't have to clean it. But many a times, as an individual or as a patient, you will not be able to um, see where you have not cleaned. So visit your dentist regularly, once in 6 months. The dentist will examine your teeth and then decide whether cleaning is required for you or not. Maybe in one or two areas where you are unable to brush properly, only that area may be requiring the cleaning, not all the tooth surfaces. Sometimes the deposits are hidden underneath the gums, which are more dangerous than the deposits which are visible. Again, those deposits you will not be able to see. Dentist will be able to detect that one and then do the cleaning. So let me check if there are any more questions. Okay, there is a question somebody has asked about yeah, salt and lemon. Can I use salt and lemon to relieve gum pain and to clean the teeth? Well, this is a common practice in some cultures to clean your teeth with something which is sour, so that it appears white, as well as there'll be relief from the gum pain. Yes, it may relieve the gum pain, but using salt and lemon together, or for that matter, using lemon to clean your teeth, may be dangerous, because the lemon is acidic. It has citric acid, and it is quite concentrated when you use direct lemon juice. So this acids can soften your tooth surface, and when you brush it with even paste, or if it is combined with salt, it is even more dangerous. Salt is more abrasive, it is more coarse. So already the tooth is softened by using lemon, and then you brush on the teeth with the salt. It will remove the outer layer, that is enamel is removed from the tooth surface, and there may be increased sensitivity of the teeth. Now, also at this juncture, I would like to inform that many of them have habit of drinking lemon water early in the morning, maybe with honey, or some of them even drink apple cider vinegar. So, which may be good for your health, but uh, you need to be cautious about your teeth as well. You can drink lemon juice or lemon water juice, and also apple cider vinegar, but don't brush your teeth immediately after drinking it. So all that you need to do is drink maybe a plain glass of water after you rinse, after you drink this lemon water, and give some gap between brushing and using or drinking lemon water or apple cider vinegar, because these are all acidic in nature, and it may damage your teeth if you're doing if you're not cautious about it and using it for long term. Okay, there is one question, interesting question. Uh, Let me answer this in Kannada, because the question is asked in Kannada. So here the question is, uh, yeah, my gums don't hurt. Gums problem ಇಲ್ಲ ನನಗೆ, ನೋವೇನೂ ಇಲ್ಲ. ಆದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ ಡೆಂಟಿಸ್ಟ್ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಯಾಕೆ ಹೇಳ್ತಾ ಇದ್ದಾರೆ? ಹ್ಮ್, ಇಲ್ಲಿ ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ ಇದ್ದಾಗ ಯಾರಿಗೂ ನೋವು ತಕ್ಷಣ ಬರಲ್ಲ. ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ ಇವಾಗ ಹಲ್ಲು ಹುಳುಕಾಗಿದ್ದಕ್ಕೂ ಮತ್ತೆ ಆ ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ ಕಂಪೇರ್ ಮಾಡಿದಾಗ, ಹಲ್ಲು ಹುಳುಕಾದ್ರೆ ತುಂಬಾ ನೋವಿರುತ್ತೆ. ನಿಮಗೆ ರಾತ್ರಿ ನಿದ್ದೆ ಮಾಡೋಕ್ಕಾಗದೇ ಇರೋಷ್ಟು ನೋವು ಬಂದ್ಬಿಡುತ್ತೆ. ಅಥವಾ ತುಂಬ ಜುಮ್ ಅಂತ ಇರುತ್ತೆ. ನೀವು ತಕ್ಷಣ ಡೆಂಟಿಸ್ಟ್ ಹತ್ರ ಹೋಗಿ ಏನಾದರೂ ಮಾಡಿ, ಏನಾದರೂ ಮಾತ್ರೆ ಕೊಡಿ ಅಥವಾ ಏನಾದರೂ ಪೇಸ್ಟ್ ಕೊಡಿ ಅಂತ ಹೇಳಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ತೀರಾ. ಆದರೆ ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ ಆ ರೀತಿ ಅಲ್ಲ. ಪೇಯ್ನ್ ಇರೋದಿಲ್ಲ. ತುಂಬ ಜನರಿಗೆ ಅಥವಾ ಮೋಸ್ಟ್ ಆಫ್ ದೆಮ್ ಯಾರಿಗೂ ಪೇಯ್ನ್ ಅಷ್ಟು ಜಾಸ್ತಿ ಬರೋದಿಲ್ಲ. ತುಂಬ ಜಾಸ್ತಿ ಆಗೋ ತನಕ ನಿಮಗೆ ಪೇಯ್ನ್ ಇರೋದೇ ಇಲ್ಲ. ಸೊ ಅದರಿಂದ ನಿಮಗೆ ಪ್ರಾಬ್ಲಮ್ ಇರೋದು ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಆದರೆ ನೀವು ಡೆಂಟಿಸ್ಟ್ ಹತ್ರ ಹೋದಾಗ ಅವರು ನಿಮಗೆ ಒಂದು ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ಯೂಸ್ ಮಾಡಿ ಹಲ್ಲು ಮತ್ತು ವಸ್ತುನ ಪರೀಕ್ಷೆ ಮಾಡಿದಾಗ ಪಾಕೆಟ್ ಅಂತ ಒಂದು ಇರುತ್ತೆ. ಇವಾಗ ಒಂದು ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ನಾವು ಹಾಕಿ ಮೆಜರ್ ಮಾಡುವಾಗ ಅದು ಇನ್ಸ್ಟ್ರೂಮೆಂಟು ನಿಮ್ಮ ವಸ್ತು ಒಳಗಡೆ ಹೋಗ್ತಾ ಇದ್ರೆ ಅಲ್ಲಿ ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ ಅರ್ಥ. ಸೊ ಅಲ್ಲಿ ಆಗ್ಲೇ ಸ್ವಲ್ಪ ಡ್ಯಾಮೇಜ್ ಆಗಿರೋದ್ರಿಂದ ನಿಮಗೆ ಪ್ರಾಬ್ಲಮ್ ಇರುತ್ತೆ. ಸೊ ಆದ್ರಿಂದ ನೀವು ಡೆಂಟಿಸ್ಟ್ ಹತ್ರ ಹೋದಾಗ ನಿಮಗೆ ನೋವು ಇಲ್ಲದೆ ಇರಬಹುದು. ಆದರೆ ಎಕ್ಸ್ರೇ ತೆಗೆದು ನೋಡಿ ಅಲ್ಲಿ ಮೂಳೆ ಸವ್ದಿರೋದು ಕಾಣಿಸುತ್ತೆ. ಅದಲ್ದಲೇ ಪರೀಕ್ಷೆ ಮಾಡುವಾಗ ರಕ್ತ ಬರ್ತಾ ಇರುತ್ತೆ. ಕೆಲವೊಂದ್ಸಲ ವಸ್ತು ಪರೀಕ್ಷೆ ಮಾಡುವಾಗ ರಕ್ತ ಬರುತ್ತೆ. ಇದೆಲ್ಲ ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ನ ಲಕ್ಷಣಗಳು. ಇನ್ನು ಕೆಲವರಿಗೆ ಊಟ ಸಿಕ್ಕಾಕೊಳ್ತಾ ಇರುತ್ತೆ. ಊಟ ಮಾಡುವಾಗ ಹಲ್ಲಿನ ಮಧ್ಯೆ ಊಟ ಸಿಗಾಕೊಳ್ಳೋದು, ಮತ್ತೆ ಡಲ್ ಆಗಿರುತ್ತೆ. ಪೇನ್ ತುಂಬಾ ಕಡಿಮೆ ಪೇನ್ ಇರುತ್ತೆ. ಹೀಗೆ ಕಚ್ಕೊಂಡಾಗ ಸ್ವಲ್ಪ ರಿಲೀಫ್ ಅನ್ಸುತ್ತೆ. ಅಥವಾ ಏನಾದರೂ ಪಿನ್ ತಗೊಂಡು ಚುಚ್ಕೊಳ್ಬೇಕು ಅನ್ಸೋದು, ಟೂತ್ ಪಿಕ್ ತಗೊಂಡು ಚುಚ್ಕೊಳ್ಬೇಕು ಅನ್ಸೋದು, ಇದೆಲ್ಲ ಆಗ್ತಾ ಇದ್ರೆ ನಿಮಗೆ ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ ಇದೆ ಅಂತ ಅರ್ಥ. ತುಂಬಾ ಡಿಲೇ ಮಾಡಿದ್ರೆ, ನೀವು ತುಂಬಾ ಲೇಟ್ ಮಾಡಿದ್ರೆ ಹೋಗೋದು ಡಾಕ್ಟರ್ ಹತ್ರ, ಹಲ್ಲುಗಳು ಅಳ್ಳಾಡಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಆಗ್ಬೋದು. ಆದ್ರಿಂದ ನಿಮಗೆ ಯಾವ್ದಾದ್ರೂ ಈ ರೀತಿ ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೆ, ವಸ್ತಲ್ಲಿ ರಕ್ತ ಬರೋದು ಅಥವಾ ಚುಚ್ಕೊಳ್ಬೇಕು ಅನ್ಸೋದು ಅಥವಾ ಊಟ ಸಿಗಾಕೊಳ್ಳೋದು, ಈ ಥರ ಏನಾದರೂ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ ತಕ್ಷಣ ಡೆಂಟಿಸ್ಟ್ ಹತ್ರ ಹೋಗಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೊಳ್ಳಿ. ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಿ ಸ್ಟಾರ್ಟಿಂಗ್ ಸ್ಟೇಜಲ್ಲಿದ್ದರೆ ಇದನ್ನು ರಿವರ್ಸ್ ಮಾಡ್ಬೋದು. ರಿವರ್ಸ್ ಮಾಡಿ ಜಾಸ್ತಿ ಆಗದೇ ಇರೋ ಥರ ನೋಡ್ಕೊಳ್ಬೋದು. ಆದರೆ ತುಂಬ ಲೇಟಾಗಿ ಹೋದಾಗ, ಅಂದರೆ ಹಲ್ಲು ಅಳ್ಳಾಡಿದ ಮೇಲೆ ಹೋದಾಗ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡೋದು ಕಷ್ಟ. ಆವಾಗ ಹಲ್ಲನ್ನ ಕೀಳಲೇಬೇಕಾಗುತ್ತೆ. ಓಕೆ, ಇನ್ನೊಂದು ಕ್ವೆಶ್ಚನ್ ಇದೆ. ವೈಟಮಿನ್ ಸಿ ತಗೊಂಡ್ರೆ ವಸ್ತಲ್ಲಿ ರಕ್ತ ಬರೋದೆಲ್ಲ ನಿಂತೋಗುತ್ತಾ ಅಂತ ಕೇಳ್ತಾ ಇದ್ದಾರೆ ಒಬ್ರು. ಹೌದು, ವೈಟಮಿನ್ ಸಿ ಕಡಿಮೆ ಇದ್ದಾಗ ವಸ್ತಲ್ಲಿ ರಕ್ತ ಬರೋದು ಸಾಮಾನ್ಯ. ಆದರೆ ವೈಟಮಿನ್ ಸಿ ನಿಮಗೆ ಕಡಿಮೆ ಇರೋದು ಒಂದರಿಂದನೇ ನಿಮಗೆ ವಸ್ತಲ್ಲಿ ರಕ್ತ ಬರ್ತಾ ಇರೋದಿಲ್ಲ. ವಸ್ತಲ್ಲಿ ರಕ್ತ ಬರೋದಕ್ಕೆ ಮುಖ್ಯವಾಗಿ ಹಲ್ಲಿನ ಮೇಲೆ ಕಟ್ಕೊಂಡಿರೋ ಪಾಚಿ ಮತ್ತೆ ಕ್ರಿಮಿಗಳು, ರೋಗಾಣುಗಳು ಅದು ಬಾಯಲ್ಲಿದ್ದಾಗ ಅದರಿಂದ ನಿಮಗೆ ವಸ್ತು ಪ್ರಾಬ್ಲಮ್ ಬರೋದು. ಅದ್ರ ಜೊತೆ ವೈಟಮಿನ್ ಸಿ ಕಡಿಮೆ ಇದ್ದಾಗಲೂ ಕೂಡ ಬರುತ್ತೆ, ಅಂದರೆ ವಸ್ತಲ್ಲಿ ರಕ್ತ ಬರುತ್ತೆ. ಆದರೆ ಬರೀ ವೈಟಮಿನ್ ಸಿ ತಗೊಳ್ಳೋದ್ರಿಂದ ನಿಮಗೆ ಪ್ರಾಬ್ಲಮ್ ಕಡಿಮೆ ಆಗೋದಿಲ್ಲ. ಹಲ್ಲನ್ನ ಚೆನ್ನಾಗಿ ಕ್ಲೀನ್ ಮಾಡಿಸ್ಕೊಂಡು ಆ ನಂತರ ವೈಟಮಿನ್ ಸಿ ಕಡಿಮೆ ಇದೆಯೋ ಇಲ್ವಾ ಅಂತ ಚೆಕ್ ಮಾಡಿ ಆವಾಗ ತಗೊಂಡ್ರೆ ನಿಮಗೆ ಜಾಸ್ತಿ ಉಪಯೋಗ ಆಗುತ್ತೆ. ಇವಾಗ ಕೆಲವ್ರಿಗೆ ವೈಟಮಿನ್ ಸಿ ಡೆಫಿಷಿಯನ್ಸಿ ಇರೋದೇ ಇಲ್ಲ. ಅಂಥವರಲ್ಲಿ ಡೆಪಾಸಿಟ್ಸ್ ಒಂದರಿಂದನೇ ಅಂದರೆ ಹಲ್ಲಿನ ಮೇಲೆ ಕಟ್ಕೊಂಡಿರೋ ಪ್ಯಾಚಿಂದನೇ ರಕ್ತ ಬರ್ತಾ ಇರುತ್ತೆ. ಅಂಥವರಲ್ಲಿ ವೈಟಮಿನ್ ಸಿ ತಗೊಳ್ಳೋ ಅಗತ್ಯ ಕೂಡ ಇಲ್ಲ. ಆ, ಬರೀ ಒಂದು ಸ್ಕೇಲಿಂಗ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಅಥವಾ ಕ್ಲೀನಿಕ್ ಹಲ್ಲಿನ ಸ್ಕೇಲಿಂಗ್ ಅಂದರೆ ಹಲ್ಲಿನ ಕ್ಲೀನಿಕ್ ಕ್ಲೀನಿಂಗ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಸಾಕು, ನಿಮಗೆ ರಕ್ತ ಬರೋದು ಎಲ್ಲ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಫಸ್ಟಲ್ಲಿ ರಕ್ತ ಬರೋದು ಕಡಿಮೆ ಆಗುತ್ತೆ. ಆನಂತರ ಚೆನ್ನಾಗಿ ಹಲ್ಲು ಉಜ್ಜಿಟ್ಕೊಂಡಿದ್ರೆ ಪುನಃ ರಕ್ತ ಬರದೇ ಇರೋ ಥರ ನೋಡ್ಕೊಳ್ಬೋದು. Okay, there is one more question. Somebody has asked that I heard that gum disease can affect my heart. Is there any connection? Is there really any connection between mouth and my heart? Yes, this is an very important question. Probably you would have read in newspaper or some other magazine article that how the gum diseases affects the heart health. Yes, it is true. It is not just heart, it affects overall health. It can affect your endocrine organs, that is the mainly known one is diabetes. The poor gum health or poor oral health can affect our diabetes. Like that, it can affect other systems also, like heart, brain, and many other systems of the body, lungs, for example. So it can affect all the parts of the body. So how does it affect? So when there is gingival disease or periodontal disease, that means gum disease is there, in response to the microorganisms which enter the body through the gums, the body releases lot of mediators, means chemicals, inflammatory mediators, certain chemicals. These chemicals, it will not be just confined only to the mouth. It will enter into your circulation, blood circulation, and it travels all over the body, which at raised levels. For example, one commonly increased mediator is C-reactive protein. Okay. This C-reactive protein has very adverse impact or bad impact on the heart health. The C-reactive protein increases whenever there is any inflammation in any part of the body. And gums being one of the part of the body which is constantly, or it is easy for gums to get infected because there is always microorganisms, bacteria in the mouth. So whenever there is gum disease, the C-reactive protein increases and it circulates in the body, and it can have a adverse effect on the heart health. It is not just C-reactive proteins like this. There are hundreds of chemical mediators which are released during the gum diseases. So all these can affect different parts of the body. There are so many researches related to how the gum diseases can poorly affect the diabetic condition of the patient and also the pregnancy outcome. So patients or individuals who are pregnant and who have gum diseases, they are more prone to deliver prematurely, preterm delivery, and also it can affect the birth weight of the baby. We call it as low birth weight. Okay, there are so many research which are directing, which gives information that it can adversely affect different parts of the body. So your mouth is just like gateway to the health of the body. So if your gate itself is dirty, it's unhealthy, then obviously it will affect overall health of the body. Okay, so there are many more questions. Due to lack of time, we are almost half an hour into the session. So I'll be answering this one in probably in the comment section or uh, in the future videos if the topic is if the questions are interesting and if it requires a separate video, I'll be answering it in a separate video. Thank you all for being here. And if you have not subscribed to the channel, I request you kindly to subscribe to the channel. Once again, thank you. This is Dr. Avinash from Dental Planet.